Dr. Rachana Kulkarni, welcome again to ITV Gold. Thank you so much for giving us your time here.
Thank you very much, Aditi. Always a pleasure to be here.
Of course, we have to have you because the nation is going through a lot right now and we need advice and we need to know what's happening with COVID-19. So let's dig right into it. I have some numbers that are coming in today. We are globally looking at 91.8 million cases of COVID-19 with at least 2 million deaths, nearly 2 million deaths. In the United States, we are at 22.9 million cases with at least 381,000 deaths. My question to you has to be, why are we continuing to see this surge of cases and why can't we control it right now?
It's a very grim milestone, Aditi, that COVID-19 has become the #1 killer in the United States, surpassing heart disease and cancer. We are at this point seeing 4,000 deaths per day. It's unprecedented. And I do believe that at this point, we are paying the price for ignoring the warnings by health officials of not getting together for our holidays and having a safely distant holidays. A lot of people traveled during this holiday season between Thanksgiving and Christmas. As compared to the previous year, there was not a significant difference, considering the issues that we are facing, a pandemic that we are facing this year. People, either probably because of pandemic fatigue or overwhelming desire to see families over the weekend, over the holidays, they traveled and we got together. And that's how this extremely contagious virus spreads. All it takes is one interaction with a person with COVID-19 infection, and it spreads like a wildfire. And that's what we are seeing now.
Right. And Dr. Kulkarni, states such as Arizona, California, Texas, and a few others are seeing huge number of deaths as well as cases. My question to you is, could you give us an insight into how overwhelmed the system is right now? What is the status of PPEs and ventilators in these states specifically?
Certainly. The state hospitals are functioning really at capacity at this point. The ICUs are at capacity. Like you hear stories about people waiting for a bed in the hospital. And we have seen this all across the nation. I personally have seen it in New Jersey. In my opinion, we are worse than what we were in the spring.
Oh, wow.
There are so many people who are sick, so many people who are in ICU, and so many people dying. So it's a grim state of affairs.
Is the government able to help these situations, Dr. Kulkarni, especially when hospitals are reaching ICU capacities?
The governments are helping the hospitals when they reach capacity in ICU. Then they are transferring other areas of the hospital, such as the operating rooms, such as the recovery rooms, such as the procedure rooms into ICU, because these rooms are equipped to handle ventilators,
right,
and isolation. So that's what is being done at this point. But what pains me is to know that so many of these things are avoidable if people just pay attention to the warnings from the experts and believe in science.
Yes, for sure. So let me get this straight and right. You believe that a lot of the surge has to do with the holiday season. The gatherings that have happened, that's a huge reason behind why this is happening, so that our audience understands that they shouldn't be doing that anymore.
Correct. Listen to science. The end and the glimmer of hope is so much within reach that we all need to have a little bit more patience, so that we can see ourselves through this incredibly difficult time, and just go on the other side, get the vaccine, and just hunker down, hold tight.
Dr. Kulkarni, how are you looking at the tri-state area. I'm asking you because currently California is the epicenter of coronavirus cases and deaths. They have seen 31,000 deaths, quite a grim number. We saw a lot of death and devastation last year over here in the tri-state area, New York, New Jersey. What is your prediction for these areas that we are in? Do you see it becoming an epicenter again?
I certainly hope not, but we have the makings of one because we all are densely populated states. As opposed to some other parts of the country, we are very densely populated and a lot of young people. So they do have a desire. They have a little sense of not being vulnerable, and they do have a sense of going out. They would like to gather, and that's why we certainly have the makings of one. However, we can avoid this. And I have to say that the government officials are really doing a good job in New York and New Jersey, and my kudos to them.
The parts of the nation that are ravaging with cases right now, Dr. Kulkarni, some of them have put in stay-at-home orders. But do you think most of these states right now should be doing a shutdown or a stay-at-home order to really curb the disease?
The most important thing would be, more than stay-at-home orders, just a mask mandate, in my opinion, would go a long way. Because think about this, we all have a lot of healthcare professionals. We all have worked in a COVID-filled environment. I can share my personal experience with you that we have worked. I have taken care of COVID patients, have rounded on emergency room filled with COVID patients or unknown COVID status. But what I can tell you is PPE works. And that's why wearing a mask mandate would go such a long way. Masks should not be politicized. Mask is science. And that's why we are seeing, because a lot of people are masking up, we're not seeing that much of influenza this year.
Yes, so when we were just discussing the importance of wearing the mask, this brings me to a topic of just quickly discussing the new administration that is coming in with President-elect Joe Biden and Vice President-elect Kamala Harris. His 100 days mandate focuses on controlling coronavirus along with economic stability as well as getting kids back into school. How are you looking at this mandate? And do you think President-elect Joe Biden should place a mask mandate for the first 100 days?
I certainly would hope he does. That because, as I said, masks should not be politicized, and masks is science. Social distancing, hand washing, and masks are the three things we know can save this country. Second thing is, I would really hope that he fulfills his promise of 100 million vaccines over the first 100 days, because that is something I think which is achievable, because at this point, we do not see, the challenge is not with vaccine production and availability of vaccine.
Right.
We have the problem with the delivery system. Getting those vaccines in people's arms has been the challenge. And I hope that the new administration will streamline that process so we can deliver an amazing vaccine that we have at our disposal.
I have a lot of questions on the vaccine, but just a follow-up to what we're discussing on the vaccine rollout. A lot of government officials and some healthcare officials are urging states to use the second doses of the vaccine, which we will discuss about, as a first dose for other people, so that the vaccines are not going to waste or they're not being, held in. How are you looking at that as a doctor?
Excellent question. Excellent question. There is no science or data behind delaying the second dose. So we should do the vaccination as prescribed, which is Pfizer, second dose on day 21, and Moderna, second dose on day 28. Once again, there is no science behind that. So let's not botch this up, would be my suggestion.
Yeah, so that means you are favoring the fact that the second dose should be there for the people that have gotten the first dose.
Correct. That's how you get to the immunity. because first dose confers only 50 to 60% immunity.
Right.
And it's after the second dose that you have 95% immunity. And that's how we should do it.
Dr. Kulkarni, just talking more about vaccine, I'd like to now discuss, go a little bit into it so that our audience knows what's happening with Moderna and Pfizer. My first question to you is, you did receive your COVID-19 vaccine. I would love for you to share how that experience was for you, and what vaccine did you get?
Yes, I did. I got my first vaccine 3 weeks ago. I got the Pfizer vaccine. Tolerated it just fine. Little aches and pains, which I would typically have after getting my flu shot. So no significant side effects. And I am excited to receive my second dose tomorrow. My husband, who is also a cardiologist, he got his. Our son, who is also a physician, he got both doses. And a lot of times people say that the second dose, when the immune response is a lot more amplified as compared to the first response, that the second dose can be rather difficult. So I can share his experience that he tolerated it just fine. Can people have fatigue? Can people have some side effects? Yes. But in my opinion, it's a small price to pay for a deadly disease. So I would urge your listeners and viewers to focus on what an amazing thing this vaccine does, and look at the risk-benefit ratios. And then, considering that this vaccine, if you take in 2 dosage, can give you 95% immunity against a deadly virus, I think those facts speak for themselves.
What do you predict will happen if, say, 70% of the population gets this vaccine?
Great question. It takes 70 to 90% of the population to be vaccinated to get herd immunity. And I'm going to share with you, because a lot of people are not taking vaccine, thinking that, oh, well, you know what, everyone else will take it, and then I will just get the herd immunity. So let me tell you the statement by the World Health Organization's chief scientist. I'm proud to say that she is a woman of Indian origin, Dr. Soumya Swaminathan. She said that an estimated 70 to 90% of world's 7.8 billion people would need to receive the vaccine before achieving herd immunity. So I think everyone needs to do their part and not count on others getting vaccinated to achieve herd immunity.
Definitely. Are you comparing the 2 vaccines at all, Dr. Kulkarni? Is there a big difference between Moderna and Pfizer?
Not really. And I'll tell you why. Because Moderna and Pfizer both use the mRNA technology, which is novel and safer, in my opinion, safer technology. So, and both of them, because they are using the same technology, have shown similar efficacy rates at approximately 95%. So the structure, although the structure and makeup of the vaccine and the dosing is slightly different, because Moderna gives 100 micrograms of dosing and Pfizer is 30 micrograms, but that's not comparing apples to apple. So a little difference, but overall the basic technology is the same. The big difference in the Moderna and Pfizer vaccine is how they are being stored. Because Moderna vaccine, it does not, unlike Pfizer vaccine, which has to be stored at a very cold temperature, Moderna vaccine does not require that, and hence it's easy to transport, store, and deliver.
What about, Dr. Kulkarni, the vaccines that are coming out from AstraZeneca and Johnson & Johnson? Do you have any insight into, how efficient these vaccines would be, and do you see them being added into the vaccine list that we have approved here in the U.S.?
The efficacy, I efficacy is probably not as high as the Pfizer and Moderna, but it's still very, very good. And I definitely think that they will be added to the available vaccine pool. And that's why I'm very optimistic that a big portion of the population can get vaccinated come early spring.
Dr. Kulkarni, are most doctors around you, medical professionals and healthcare workers, vaccinated right now?
A vast majority of them are. And this, Aditi, changes state by state.
Right.
So at this point, most of healthcare workers and physicians and healthcare providers, they definitely have received first dose of vaccine. Most of them will be vaccinated by end of January. And a lot of hospital systems and healthcare systems by next week, they will open it up to first responders such as firefighters and policemen. They will be opening up the vaccine schedules. But at this point, it's limited to first responders, healthcare workers, and as I said, majority of them, and I'm speaking about New Jersey and New York, and most of them have received at least their first dose.
And just talking more about the vaccine, I have to ask you, this new variant that we keep on hearing about in the news and how infectious it is, do you think it will be efficient, the vaccine will be efficient for it, or how are you looking at it, the entire thing?
Oh, there's so much about COVID that we don't know. So I think it's possible that all the strains, just like flu, this is just a kind of a very virulent flu is how I'm seeing it, because when influenza started, it killed so many people with similar, viral transmission, more transmission in close quarters, then deteriorating to pneumonia and pulmonary infections, causing a lot of mortality. And that's what I'm seeing here with the COVID-19 virus. And just like flu, the strain mutates every year. The flu vaccine strain mutates, and I can foresee the same thing. But at this point, it seems that the Pfizer and Moderna vaccine, which are currently available, should be able to cover the new strains. But that's not to say that will hold true in the future, because the virus mutates.
Yes, this is one mystery disease, I tell you. We're still figuring out and learning so much about it.
Yeah.
How are you looking at testing and therapeutics?
Testing at this point, I think we are pretty good. Testing is widely available. Multiple different tests are available, the antigen, the PCR, the rapid PCR. So testing wise, I think we are fine. Anyone who wants to get tested can get tested. The turnaround time is pretty efficient at this point.
Nice.
What was your second question, Aditi?
About therapeutics?
Therapeutics are pretty good. Like, I think we have gotten a good handle over how to treat, what to do, what not to do. So therapeutic wise, I think we are pretty good. The monoclonal antibody, the remdesivir, use of steroids in a timely fashion has been a very nice. We have a lot of good options and therapeutic options to treat it.
Do you think, and I just have 3 more questions left here for you, Dr. Kulkarni, do you think we'll be able to send students back to school this year?
I hope so. And that all depends on following the science, people taking 2 shots of vaccines in a timely fashion. And majority, I think for schools and all, it should be mandated that people should be able to return to school only after getting the correct dose of the 2 dosage of vaccines. I hope it is possible come fall. I certainly hope so.
But for kids that are younger than the age of 16 and 18, there is no vaccine right now for them. So what do you propose in that manner?
That you're absolutely right, Aditi. At this point, the Moderna vaccine is approved for people over 18 years, and the Pfizer vaccine for people over 16 years. We don't have studies for the vaccine in young kids or pregnant women. So that is that unknown part of what to do with the kids, because you don't want to do anything to the kids. First, do no harm is the mantra, and I don't think we have enough data on it.
Oh, wow. So we'll have to see what happens with children here because, of course, they're not going to be vaccinated right now.
Correct.
Another question I have for you is, of course, our South Asian population is at high risk because of heart issues, lung issues, and diabetes. How are you looking at that right now? And how has your experience been, especially with your cardiac patients?
Sure. At this point, we are seeing like the second wave or the after effects of the first wave of COVID patients. So now, most major institutes have started doing COVID recovery patients as outpatient because people are now experiencing a lot of after effects of COVID infection. And as we know, COVID can pose challenges with the immune system as well as the clotting system. So a lot of people with thromboembolic events. So as a result of that, we now have implemented some kind of blood thinners for people who have had COVID infections.
Oh, wow, quite a lot happening there. My final question to you, Dr. Kulkarni, has to be, I would love for you to give us a prediction for the next 2 months. What should we be preparing for? And, what are your hopes with the vaccine rollout?
My prediction is we will continue to see, unless people change their behavior, we will continue to see a very high number of deaths per day for at least for next few weeks. And once people start getting vaccinated, is only then it will, hopefully the trend will go down. I certainly hope that the new administration keeps up its promise of 100 million vaccinations over the next 100 days, because that is what is going to take us through this. So I hope we all have a little bit more patience to help us see through this finish line, because that finish line is right in sight.
Well, I hope you reach out to, you have reached out to our audience, and I hope the audience still sticks to, CDC guidelines. So important, and so important to wear a mask. Thank you so much for your time today, Dr. Kulkarni.
Always a pleasure. Always a pleasure, Aditi. Thank you for the opportunity.